Hi everybody and welcome back to my channel. Today I will be talking about a lid malposition called Ectropion, meaning the lower lid usually turning outwards. If you'd like to learn more about how this can be a nuisance for patients, then please do stay tuned. So let's jump straight into this video. Ectropion is essentially a condition where the lower lid turns outwards. This can cause a whole host of problems for patients, including the spillage of tears onto their cheek, the subsequent dryness and drying out of the cornea, and therefore problems with ocular surface discomfort as well as blurriness of vision. Moreover, this exposure of the ocular surface can also lead to other issues further down the line, including potential formation of ulcers and subsequent scarring. There are several different types of ectropion. In this video I will be focusing on ectropion generally as opposed to honing in on a specific type. The various different types can be involutional or age-related, superficial, mechanical, paralytic and congenital. By far and away the most frequent type that we encounter in clinical practice is that of the involutional / age-related type, which is due to the laxity of tissues that tends to increase with age, as well as the features and symptoms that I mentioned earlier which patients can experience. They can also be prone to getting recurrent infections. Your eye care practitioner will perform a careful examination and evaluation of your lid, its position and the features that you have present. This will include an estimation of tissue laxity, ocular surface dryness, and a careful appreciation and understanding of symptoms that you are experiencing. In the short term, and depending on the degree of the ectropion, patients can be managed medically, meaning they can be given ocular lubricants, which tends to be the mainstay of treatment. But ultimately, over time, as the condition will potentially worsen, patients will require corrective surgery to re-establish a more anatomically normal lid position. Ultimately, the lower lid will need to be shortened to correct for the laxity that is present. There are a whole host of different surgical options that can be potentially deployed to try and correct a ectropion. However, these different options are outside the scope of this particular short video. The other thing to mention here is, depending on the underlying cause and type of ectropion, management may differ slightly. For example, in the case of a paralytic ectropion, which usually comes about due to a seventh nerve palsy, i.e. a Bell's potentially, these patients will usually require intense lubrication and potential lid closure in the short term, and further down the line they may very well require surgery depending on the nature and extent of the recovery that they make. However, they may also be potentially offered gold weights as a treatment option, as well as Botox. Thank you very much for watching this short video about ectropion. I hope I have provided you with a very brief overview of the different types of ectropion, what ectropion is anatomically, how it tends to impact upon patients in terms of the symptoms that they will experience, and what can be done in terms of managing the condition. If you have found this video useful, please do click the like button, the subscribe button, please do comment, and if you would like to stay up to date with my videos, then please do click on the bell icon. Thank you so much. Until next time, take care.